So let's talk about diabetic foot ulceration and how a remote patient monitoring system works. Next slide. So when you're selecting an RPM system, there's a lot of things that you have to identify, and you have to really realize what is beneficial for you, your staff, and your practice. Okay. Physiological parameter must be within the practitioner's scope of practice. Know what you can do and what you can't do. It's pretty simple, right? Pressure adherence, step counts, and temperature. And I educate these patients. Hey, listen, I'm gonna tell you right now, these insoles that you've got, this is what they're gonna monitor. And you know what? With my phone right here, I'm gonna get an alert. You're gonna get an alert, and you're gonna get a call from my nurse regarding what's gonna happen next. Okay? So they go, wow, they're either blown away, they feel guilty, and or both, right? Which is great. Okay. Staff requirements. The staff has to understand there is going to be some monitoring, but it's extremely simple. Okay. Each month I have my nurse just pull it up. Let's see what they're doing, and we take it from there. Standard practice and workflows. I have them do that while I'm in surgery. Keeps them busy, occupied. They stock the rooms, and then they get on this. Okay. Accuracy of measurements. This is huge. Okay. A lot of times what happens, and our best control against patients is what? The progress note, right? This gives me, or gives us, an opportunity to background information. Hey, listen, you said you're doing fine, right? And you said you're staying off your foot. Well, I have it right here, woohoo, okay, that you're not, okay? That we've called you multiple times. We put notes in your chart that are not accurate to what you're telling me. So do you want to start this conversation over? Inevitably, what happens is say, yeah, you know what? Or a family member who's with them says, yeah, they're not doing it, okay? Patient considerations. Not everybody's going to be able to adapt this concept. And some of them you don't want to, but majority of people understand the fact is, hey, this is pretty cool. This is something I can use. Patient ease of use, it's right on their phone. Okay. You might have to take 5-10 minutes to discuss it with them, but it's as easy as stepping in a box, send it away, and then we actually are able to identify the pressure points and send them to them. It's phenomenal. Okay. Wi-Fi or cellular network connection, make sure they have got good of that. Cost of the patient, i.e. copays, identify that and identify those patients, because you don't ever want that phone call that says, you know what, I didn't know I was going to do this, right? Or going back to the 10% that they actually really understand, make sure that they understand that, okay? And make sure they have a consent form that's been signed that allows you through the cloud to identify this information and where the temperature, where the adherence, and where the pressure points are, so we can identify this. So we got to have that consent form in there. Next slide.